is a sheep's heart. I present to you the sheep's heart. We have the posterior side of the heart right here, and the anterior side of the heart. The anterior side and the posterior side are covered with this epicardium, which it's a transparent layer. It's protecting the heart. It also prevents from friction. If we had a normal heart, it will have the pericardium around it. That is a much harder lining or sac, you can call it, that protects the heart from friction from structures like the lungs, so it won't friction with it, right? So now let's we cut the heart in a frontal plane view, so every time we open it, it's like up and down, or anterior and posterior. So now let's talk about the flow of the heart. But first, we should know the coronary sinus, which is this kind of structure. So if you want to find the posterior side of the heart, just remember the coronary sinus is always in the posterior side of the heart. Now again, to the blood flow. So blood will come from the body and it will enter the vena cava. This will be the inferior side, and if it were not cut it off, it will go all the way down. And the superior side, from superior side and inferior side, the blood will go inside. And going inside, it will go straight to the right atrium. Right here, this is the right atrium. And again, if we open it there, you can see the tricuspid valve. The blood will go straight through the atrium to the tricuspid valve and inside the right ventricle. From the right ventricle, it will go to the semilunar valve, which we cannot quite see, but if we were able to see it, it's somewhere inside there. It'll go all the way up, up, up. It'll go to the pulmonary trunk. From the pulmonary trunk, it will go to the lungs through pulmonary veins. From the lungs, it will go back to the heart through the left auricle, which will be this side. From the left auricle, it will enter the heart through, again, the pulmonary arteries. Oh, sorry, wrong side. It will go from this part, which will be the left atrium. It'll go past through the bicuspid valve. This is a bicuspid valve, but it's all mushy. Can you see it? It'll go right through the left ventricle, and then up, up, up again. If we could see it, up again through this side, all the way up to the aorta right here. Can you see the aorta hole right there? So from the aorta, it will pass all the way to the heart. So that is the aorta arc. If you can see 3 little holes, 1 hole, 2 holes, 2 holes and 3 holes. Okay? And if we go back inside the heart, we can see that the ventricles are lined with endocardium, which is a lining. You can see the difference between this side and this side, quite different. And then you can see the septum, which divides the heart sagittally. Oh gosh, that word. Okay, divides the heart sagittally, so left and right. You have the interventricular septum, which is this lower part, and the atrioventricular septum, which is this lower part. Atrioventricular will divide the atrium, the left atrium from the right atrium, and the intraventricular side will divide the left ventricle from the right ventricle. Again, this muscle, because it's muscle all around, it's called myocardium, mayo for muscle. And, oh, I forgot to mention, this is a chordea tendonae. These are cord-like structures that hold the valve together. You can see the valve right here. So it's holded together by this chordea tendonae. Prevents it from it to flap or go into the atrium, and the blood that way cannot go back. It is held through the ventricular side. It's held by the papillary muscles in the ventricular part, so you can see it right here, or right here. There you go. Now, an easy way to distinguish the left from right, remember, is that the left wall is thicker than the right wall. So left is thicker than right. You can see the right is just like the length of my tip, while on this side is like 2 times my tip. Okay, and I think that's it for the heart.